Topic is investment in public health initiatives. Our lead speaker is Josel Reina, and we had two panelists here, Kavita Mehra and Valerisa Begar. So I would like to invite Josel Reina to have few words. Thank you, sir.
Thank you very much. Good morning, everybody. I'm going to keep it a little bit informal and have it more of a discussion type of a presentation. But I have some thoughts about investment in public health. And actually, I just discovered that all three of us here are from the United States, and we're impacted by the recent, what's called the Affordable Care Act, and how we provide healthcare initiatives. And so, but mainly how we invest in public health. And I want to talk a little bit about where I'm from, so you have a bit of a context. I'm from Michigan. Hospital systems there are nonprofit. That means that they can't operate as a commercial enterprise, and they can't accept venture. They don't pay out profits. However, they still have to be sustainable, financially sustainable. So that's we are, as a healthcare system throughout the country, a very lucrative business actually. But the problem has been that we have done in a way that has been treatment of illness, not necessarily the treatment or promotion of wellness. And that's now transformed because of the Affordable Care Act, and we're being driven to then look at how we provide healthcare in a sustainable way, but yet in a way that promotes health. The division I work in is called Healthy Communities, and actually it's funded through an annual allocation of about $8 million that we use to provide healthcare for the medically underserved. And although we do it without any reliance on reimbursement, we still have to find a way of sustaining it financially to make sure that we're not wasting money, because we could provide an infinite amount of resources to make sure we're addressing health issues, but that just doesn't make sense. So what we do is, in my work, is I try to identify areas of wellness promotion and find ways of making it sustainable, because if it succeeds, then we can replicate this elsewhere. So I look at different therapies, and what I've looked at here, for example, I've listened to presentations on holistic health, whether it's hypnosis, reflexology, meditation, yoga, which is all very valid practices, but I'm finding that there's not a whole lot of empirical data that supports to what degree is this effective, and the other thing is to what degree is it financially sustainable. If you do this, if you pay for it, then are you going to be receiving some sort of benefit? Are you going to be able to make a living doing this sort of thing? So that's really the operation that I work in. And what we do, for example, I would set up clinical trials to say we'll test a group and see to what degree has your behavior changed, to what degree has your health changed, and how much does it cost to impact that change. And so we run test groups and see if truly it works. So I'm looking at the effect, not necessarily the why it works, but does it work? And so that way we can then calculate what we've done. I'll go back to the models of healthcare that we provide, and it's for those that are at risk of chronic diseases like diabetes and heart disease. And if I look at a population like Hispanics, blacks, Native Americans, they have a high level of risk for those particular chronic diseases. If I look at those that have, if I provide interventions in the area of nutrition, for example, if I have a group that I try to give a nutritional option, for example, giving them access to organic food, a high degree of vegetables and produce, then to what degree has this been effective? And I measure that. How much did it cost for us to provide that? And what actual empirical evidence showed that their biomedical results improved? And then I've done that, and I've run trials, and then I can say this was a cost in terms of how much we invested in this. Then I also look at factors of expense. For example, to what degree do we avoid somebody going to the emergency room or being admitted to the hospital or taking medication? And then I can calculate then what the financial benefit was or the return was. So that's what I do is I look at interventions. I look at to what degree has this been helpful? Has it been truly evidence that it makes a difference? And then what is the financial return? So I can do this, for example, for a group that I run. It's called Core Health. This is a program for people who have diabetes and heart failure. And I measure the amount of times they've been to the emergency room, the amount of time that they were in the hospital prior to being enrolled. Then during the time of enrollment, I measure then what the frequency was based on interventions we provide around nutritional wellness, physical activity, general health literacy, and then determine how many times have been to the hospital or been into the emergency room, and then calculate the difference. So I've had return on investment in that case for every dollar spent, a return of 7. So in the last 3 years of operation, I would say the hospital system, being Spectrum Health, about $7 million for just Spectrum Health. But because we service people from all over the community, the entire impact of that to both industry and other healthcare systems has probably been about $20 million per year. That's from about a $2 million investment. So it's been phenomenal in that regard. So that's how I have to prove that. So payers and insurance companies can say, we don't know whether this particular intervention works, but because you're proving this financial benefit, we are willing to pay for that cost. So that's how that system works for us. So I want to invite others to speak about their experience. It may be related to this, but also how they're transforming the investment or healthcare in their communities as well. I'm going to turn to you first.
Hi, good afternoon or good morning. So, by a show of hands, how many of you spent the first 18 years of your life without seeing a dentist? Okay, that's what I thought. How many of you have gone hungry for an extended period of time? How many of you couldn't afford to buy glasses? How many of you have experienced high levels of trauma for extended period of time? How many of you know somebody who was murdered? So this is the area that I serve. I work for the Boys and Girls Club of Newark, and the children that we serve and that we work with, it's about a little over 1,000, have those experiences on a very consistent basis. Newark, New Jersey is the largest city in the state of New Jersey, but it's also the poorest. It's one of the poorest cities in the country, and we work in one of the poorest areas of the poorest city, one of the poorest cities in the country. And what our children often experience is levels of trauma, lack of access to public health or population health initiatives, preventative care. They go hungry for an extended period of time because food insecurity is a major issue in our community. So at the Boys and Girls Club of Newark, we really believe that we can change a child's life. We can change the trajectory of a child's life. And we invest in initiatives that will close the achievement gap. How do we support children? How do we support families so that they have access to care that they traditionally wouldn't have access to? Because what we know right now in the United States is that being poor means something different than it was 10 years ago, 20 years ago. Being poor right now is a very different landscape, especially given the concentration of wealth in the United States. So we have invested heavily in population health work. We're the only Boys and Girls Club in the country to have a free pediatric dental center in our clubhouse, where last year we saw 700 members completely for free. We're also the only Boys and Girls Club in the country that has free pediatric eye care and eyewear. So we have a rotation of optometrists and ophthalmologists that come in several times a week and provides our members with high quality eye care and eyewear. And again, that's completely for free. And then we're also the only Boys and Girls Club in the country that has a licensed social worker on staff and case manager, because what our children experience is high levels of trauma on a very consistent basis. So what they will often do is sort of gravitate towards negative behavior, and where a social worker plays a critical role is in enabling our children to talk about what they're experiencing, because oftentimes our community is really supporting internalizing what our children are going through. And so really examining the impact of that work is that we've pivoted as an organization to not just serving children, but what we are is a mechanism for being stable for families. What we say to ourselves is, what do families not have access to? What is our responsibility to be able to serve those families? Because what we know is that when we invest in a child, and when we invest in families, the opportunity to break away from poverty is much greater. So I'll leave you with this. I'll leave you with this story. But a colleague of mine was 6 years old. He was a member at the club, and he started when he was 6. And then a few years into his membership, he lost his father to AIDS, the AIDS epidemic that hit Newark, New Jersey, and this is in the late 80s. And then a few years later, right before his 16th birthday, he lost his mother to AIDS as well. And then his family was split up. So he and a sibling lived with an aunt, and then his 2 other siblings lived with their grandmother. And so he was not even staying with his whole family. He then went on to win our most competitive award, which is called our Youth of the Year Award. This was back in 2000. He was featured on the Oprah Winfrey Show. And then he won the State Youth of the Year Award and then the Regional Youth of the Year Award. So he continued to excel. He went to university. He came back to the club and he's continued to work at the club for the last 14 years. That's the impact. That's a success story. That means that we're clearly doing something right. But then how do we take that at the macro level, right? He's one guy. And right before I was leaving to come to India, he was crying in the office, and I realized it was because Mother's Day had just happened. So the effects of trauma stay with our members, they stay with our children, they stay with our community, and what we need to do is be able to sort of alleviate those stresses. And I wanted to share that story with all of you because the work that we do is so real and so tangible, and these investments are very cognizant. So for us, it's been able to really help effectuate change and something that we're incredibly proud of.
Good morning, everyone. My name is Valerissa Baker, and I'm representing US like everyone on this panel. Yeah, can you hear me now? Okay. I was saying, good morning. My name is Valerissa Baker, and I'm from US. I am a Master in Public Health student at the Boston University School of Public Health, and I'm concentrating in both health management and policy and global health, so this topic is really important to me. Currently in the United States, we spend about $3.2 trillion on healthcare. But we don't put too much of those funds into public health initiatives. We're focusing a lot on treating diseases and injury, but we're not focusing too much on prevention. So I'm really working on studying different ways and strategies to, change the statistics and increase health equity and accessibility, but also really targeting public health issues that, occur all around the world, but America's putting a lot of money out into global issues, but we have those back at home as well. Besides investing funds, I feel it's really important to do a lot of volunteering because volunteering does a lot as well. It's also twofold. It doesn't only impact the people that you're targeting, it also helps the individual. And specifically, I just wanted to talk about like different organizations that I'm a part of. So besides being a student at Boston University, I'm also the president of the Rotaract Club at our institution, and I have a strong affiliation with Rotary Foundation in Boston. But I've also worked with them on a global scale. So I've done work in Australia, I've done work in Cambodia, and I just really love that the organization has a lot of connections, and I think that's really important. I feel like that's even the reason why we're here at WEF, to meet other people that are representing other countries and discuss like different changes that need to be made. In short, I like to think of public health and medicine and compare it to like nature. So as medicine kind of works like on like it'll deal with trees individually, right? Public health is working like on forests. So if you consider it that way, medicine can kill on like an individual scale, but public health can kill by the mass. So it's really important that we invest more time and we concentrate on how to really increase these public health initiatives and the funding